Hey everyone, this is Miss Davis. We're going to discuss teaching and learning. Okay, so some of our learning objectives. Let me try to move this out of the way. We're going to talk about some factors that contribute to expanding the role of teaching in professional nursing. Describe some of the concepts of teaching and learning. We're going to discuss the Bloom's taxonomy. There we go. We're going to describe the 6 levels of cognitive thinking, discuss the factors that can affect learning, 6 barriers to learning, some strategies for motivating learners, strategies for working with people of different cultures or learning differences, how to perform learning assessments, and how to apply the nursing diagnosis deficient knowledge to various people. And we're going to develop teaching plans, methods of evaluating outcomes, how to document teaching content. Okay, why do nurses need teaching skills? Why do we have to be teaching? You're here to be a nurse, right? So the purpose of teaching is that we're going to want to empower our patients and their families. We want them to be performing self-care, making informed decisions about their healthcare options. We can teach and do interventions to try to promote wellness, prevent illnesses, restore their health, adapt to changes. So all of these things are really important. So the ANA states that the registered nurse seeks knowledge and competence that reflects current nursing practice and promotes futuristic thinking. So registered nurses' teaching activities include providing health teaching that addresses such topics as healthy lifestyle, risk-reducing behaviors, developmental needs, activities of daily living. We're going to use health promotion and health teaching methods appropriate to the situation. Make sure that it's information that is in line with the patient's values and beliefs, their health system, their language preference, their culture. We're going to seek opportunities for feedback and evaluation. We're going to use information technology to communicate health promotion and disease prevention, and we're going to provide healthcare consumers with information about intended effects and potential adverse effects. Okay, so why do nurses need to be able to teach? So we want our patients to participate in healthcare decisions. We talked about that Joint Commission Speak Up campaign, where they're trying to encourage patients to be a participant in their healthcare decisions. We want hospital stays to be as brief as possible because healthcare is expensive, right? So we want to make sure that nurses are doing their best. We want people to be appropriately cared for, but when it's time, they need to move home. So we want to make sure that we're doing everything we can, and as nurses, one of the things that we can do is educate our patients. So this is Bloom's taxonomy. I talked about that on that first day of lab that we had, where I came in and did a little lecture on some different things. But this is what our questions are based off of. These are the same thing that the NCLEX uses to base their questions off of, and it's exactly the same design. So right now the questions that you're getting are mostly the remembering and understanding questions. We give you a good bit of applying and just a couple of the analyzing. So as you move through the program, we'll increase with more applying and analyzing and evaluating kind of questions and less of the remembering. So this is the same thing. It applies to patients. So remembering is just memorizing or recalling information, where understanding is actually summarizing and interpreting the information that you are given. So all of that is really important. So cognitive, these are 3 domains of learning. So cognitive is a storage and recall of information. So cognitive can be ranging from simple to complex processes. There's 6 levels of behavior: memorization, recall, comprehension and analysis, synthesis, application, and evaluation. Strategies and tools to support teaching in cognitive type content include lectures, reading material, panel discussions, AV material, programmed instruction, computer assistant instruction. So all these different things that we're working with you all, case studies, care plans, those are all ways of learning. So psychomotor are those hands-on skills. So these skills require mental and physical activity. It requires the learner to accept and value strategies and tools used are to teach psychomotor skills include demonstration, return demonstration, simulation models. So all these same things that we're using with you, DVDs, journaling, self-reflection, all those things are part of this. So the affective domain of learning, these are strategies and tools that promote effective learning, including role modeling, group work, panel discussion, role playing, mentoring, one-to-one counseling, audio-visual material, streaming videos, computer-based models, or movies. Social learning theory explains the characteristics of the learner. So, self-efficacy is a major concept in social learning theory. It refers to a person's perceived ability to successfully perform a task. The behavioral learning theory is characterized by identification of information to be taught and immediate reward for correct responses. It has its roots in psychology and the belief that the environment influences behavior and, in fact, is the essential factor in determining human action. Cognitive theory sees learning as a complex cognitive activity. Learning is an intellectual or thinking process in which the learner structures and processes information. It also recognizes the importance of developmental stages and social, emotional, and affective learning influences. Humanism focuses equally on the learner's emotional and intellectual attitudes. It emphasizes the learner's active participation and responsibility in the learning process. Learning is thought of as self-motivated, self-initiated, self-evaluated, and its purpose is self-development and achievement of the learner's full potential. So there's 5 rights of teaching. So you want to teach the patient at the right time. Are they free of pain? Are they very anxious? Are they motivated to learn? Those are all important things. Have you developed a trusting relationship with that patient? Did you set aside sufficient time for teaching the patient? The right context. So is the environment quiet, free of distractions? Is it private? Is the environment soothing or stimulating, depending on the desired effect? Right goal. So is the learner actively involved in planning the learning objectives? Are you and your patient both committed to reaching a goal? What about family and friends? Are they included in the planning? Because they may need to be involved if there's some sort of behavioral change that needs to be made. Are the learning objectives realistic and valued by the client? If the patient doesn't have any value in or see value in what you're trying to teach them, they're not going to learn the information. Right content. Is it the right content appropriate for the patient's needs? Is it new information, or is it just reinforcing old information? Is it presented at the learner's level? So we should not be speaking in medical jargon. We need to speak at that patient's level. And then the right method. Does the strategy fit the learning style of the learner? If you know they're a visual learner and you bring them a whole bunch of stuff to read, that might be a little overwhelming. Maybe something with some pictures. Making sure you understand what's best for the patient. Now, one thing I do want to mention when we talked about, I'm sorry, I do that every time, that I do want to mention about right timing. You don't want to go in to talk to somebody about something that's life-changing. So I've just got a life-changing diagnosis. That's not the appropriate time to try to start some teaching, okay? At that point, you need to be supportive of the patient, and then once they've had some time to think about things, then you can kind of go back and do some teaching with them. Some factors that affect learning. So their motivation is their desire to learn. Usually if a patient has some buy-in, meaning I see that if I can do these things, if I can change these things, that it'll make a big difference in my life, then they'll be motivated to learn. Are they ready to learn? Usually, are they asking for the information? Are they comfortable and able to learn what's going on? What's their physical condition right now? Are they in pain? How's their coordination? How is their energy? So we want to make sure that all those things are looked at. What about their emotions? Are they in severe anxiety or stress? Are they emotional with pain? Do they understand what's going on? That would not be a good time to try to teach somebody about about their disease process. Timing. People retain information better when they have an opportunity to use it. So if I have to say teach my patient how to give themselves insulin, the best time to do that would be at time to give insulin, right? Do some teaching, show this patient how to give themselves an injection. Then the next time, show them again, help them draw up the medication. If it's a pen, dial it and let them do it. Okay, timing is real important. Active involvement. So we want the patient to be engaged in what's going on. Learners retain 10% of what they read, but they retain 90% of what they speak and do. This is why we encourage you all to sit down and talk through this information with each other. So 90% of what you retain is because you're speaking it out loud or you're acting on it. So they need to be actively involved. So asking your patient questions, repetition, repeating the information. That's also important. Your learning environment. You don't want to try to teach somebody something and being in the middle of a very busy, active hallway or in a room with lots of other people. All right, so if you need them to learn something, you need to sit together somewhere where you can be private and really focus on the task at hand. All right, so the scheduling of the session. It's not good to try to teach somebody something when they're in pain. All right, so maybe we need to get them comfortable let them have a little nap, wake up, and then we're going to talk about what we need to discuss. Maybe you can only do 10 minutes of teaching every couple of hours. So then that's something you need to think about. The amount and complexity of the content. If it's really hard information to understand, like understanding how diabetes works, that's a very complex content. That's something that's not going to be done in small sessions. So it's possible that this patient may need some outpatient teaching. The teacher and the learner need to be able to communicate. So if you don't speak the same language, you're going to have to think about having an interpreter. If the patient is visually or hearing impaired, that's something you need to think about. Special populations. So depending on whom you're talking to, you might want to ensure you're also talking with whoever is the caregiver, because these people will also be involved in what's happening. That also ties into your developmental stage. So if you're dealing with someone very young, you'll need a parent to be there as well. Cultural sensitivity. So we need to make sure that we are culturally appropriate and not trying to teach someone to do something that they would find not appropriate for them. Then health literacy. So this is that ability to understand the health information. So sometimes it's a good idea just to ask your patient, what do you know about your disease process? What are you understanding? Because what they understand and what level they're at, it may be totally different than what's actually happening with that patient. So some barriers to teaching and learning. So barriers for the teacher can be that you don't have the time, that you have a conflicting schedule when you're free and when the patient has time to learn. There's no space for privacy. Teaching is not seen as a priority by the teacher. There's no reimbursement for it. Maybe there's a lot that has to be done and the learner is upset with that. Okay, so barriers for the learner. So is the learner anxious? Are they stressed? Do they have a low health literacy? Are they overwhelmed by the information? Are you using technical terms? All those things are barriers for the learner. And then barriers to technology-based learning. So maybe some of the information is technology-based that you need to get the patient or would like to get the patient access to, but maybe they don't have the internet. Maybe they don't have a smartphone. Maybe they don't have an iPad. So those are things that we need to think about. So safe, effective nursing care. So suppose you are the nurse planning discharge teaching to a frail, elderly man who suffered a stroke. He will be cared for at home by his daughter. What's the best approach for planning discharge teaching? Myself as a nurse, if I'm sending this patient home, I'm going to want the daughter there to do all the teaching with both of them at the same time. That way they can both discuss and ask questions, and that way you can also give the information to both of them at the same time. How are we going to show caring for this patient? So we're going to try to sit down, look them in the eye, discuss the teaching, try to go at a slow pace, give time for them to sit and talk, and make sure that your patient is comfortable before you start your teaching. Okay, so how are we going to promote safe self-care, shorten hospital stays, reduce errors, and prevent rehospitalization? So a lot of these things can be done with education. So that's kind of the role of the nurse. So let's look at this knowledge check. The client needs to be taught how to find and check his own radial pulse. The nurse will complete this teaching only if the client asks her to do so, when the client recognizes the need to learn the skill, before pain medicine is administered, or right before the client is discharged so he can remember the skill. So the best answer for this one is B. The client will be most motivated to learn when he recognizes why it's important. Okay, so some components of a learning assessment. So we're going to think about first our intended audience. Who are we teaching? What's their age and occupation? What's their developmental level? Are you teaching one-on-one or in a group? Then we're talking about learning needs. So what's the client's medical problem? I mean, what are we going to be teaching about? What kind of behavior needs to be changed? What self-care knowledge and skills does the client need in order to care for themselves? What about their knowledge level? So for this area, we need to know what does the client understand? What's the patient understand? What's their level of learning? So we want to ask them some things like, what do you think caused your health problem? What are your concerns? How has it affected your life? Health beliefs and practices. So we're going to ask the patient some things like, what do you usually do to stay healthy? What problems do you think you are at risk for? So those will give you some insight into what, how the patient processes information. Physical readiness. So we're going to check their ability to concentrate, their dexterity skills, their pain level. All those are important. Emotional readiness. So we're going to find out whether the client is experiencing anxiety or emotional distress, because that's going to interfere with their ability to learn, which leads us to ability to learn. What are their cognitive and psychomotor developmental abilities? How do they problem solve? How do they recall information? What is their literacy level? So can they read and write? Does the patient speak the same language as you? Neurosensory factors. What's the client's ability to feel, to see, hear, or grasp information? And then their learning styles. We talked a lot about that. Is it are they a visual or auditory learner? You may need to gear your information to that. So, thinking about nursing diagnosis. So deficient knowledge is one that we use a lot. We use deficient knowledge, but a lot as nurses. But you really want to use it if you believe that the lack of knowledge is the primary problem. So you don't want to use it just because I can't think of anything else. As a deficient knowledge, like for everybody, so everybody gets deficient knowledge. Really make sure that that's what you're using it for, is a patient that doesn't have the information that they need. I hope that makes sense. Planning outcomes. So you can make a learning contract. That's just a statement of understanding between the teacher and the learner of how they're going to achieve the goals that they've set. The responsibilities of both of them. Teaching goals should be broad in scope, and really it should be talking about the final outcome. And then our objectives are specific behaviors that must be completed to accomplish a goal. So some components of a teaching plan. So teaching strategies are the methods used to present the content. So lecture, demonstration, return demonstration, one-on-one instruction, mentoring. Those are all examples of teaching strategies. So the content that's included in your information is something that has to do with the goal you're trying to reach. So scheduling and sequencing, you should present simple before complex topics. You must also determine when the teaching sessions are started, that it's based on the client's and the teacher's need. If it's extensive content, so we're trying to teach about the process of diabetes, then you need to schedule several sessions with the patient. And then your instructional material. What are you giving them? Is it something that's easy to understand, or is it written at a higher level? If so, then you'll find that the patients are not going to read it. So here's the teaching plan sample for diabetes, and it just gives short little pieces of information along with pictures and some videos that the patient could watch. Here's another one for the incentive spirometer. It gives you very brief directions, exactly how to do it, along with, a picture. Here's another one where they're discussing the MyPlate, nutrition. It's from the Department of Health and Human Services, where they discuss how much you should be putting on your plate. So doing nutrition, teaching with your patient. So examples of teaching strategies: lecture, we do that every day, right? We have group discussion, we demonstrate, you return demonstrate. We sit down one-on-one and discuss or mentor you. Digital sources of information and printed information, we do that. We're giving you digital sources. We're giving you a PowerPoint in digital version. We give you printed materials. Role modeling is going to be similar to what we do in the simulation areas, and that's where you discuss something. Oh gosh, I'm so sorry, y'all. I'm such a goofball. Let me get us back to where we're supposed to be. Role modeling so is in more of like a simulation type of environment, where your online sources of information might be your CDC, your ANA, those different kind of things. And this is about teaching with the patients, but because you can apply this to what you're doing right now, that's why I'm giving you examples of students and us and the way we kind of instruct. All right, so your patient is an adolescent girl recently diagnosed with diabetes type 1. You develop a teaching plan for insulin therapy and dietary management. While you're teaching, she is texting and not paying attention. What could be another way to teach her if she resists your approach? So clearly she likes to be on her phone. I'm sure there's an app that teaches about diabetes mellitus, or there's websites or something that she could get to. That might be a good approach for her. What would happen if she failed to learn to manage her insulin and diet correctly? Well, she could go into diabetic ketoacidosis, or she could, start losing circulation in areas. So lots of things. What other ways are there to look at the situation? You also have to look at, you're talking to an adolescent girl. So the teaching should be different. It should be different than what you give an adult. So those are some things that we have to think about. When we're evaluating our learners, we ask questions, we interview them, we ask them to do a questionnaire or a checklist. One of the easiest ways to evaluate a learner is what we do. We test you, right? Or we quiz you. We ask you questions. We ask you to write things down. We observe you in SIM and in Skills Lab, and you have to demonstrate tasks for us, which is our checkoffs. So please take a minute and watch this little video about evaluating learning. And if you have any questions, please let me know. You can shoot me an email and I'll be happy to respond to you. Thanks, guys.